You may find that when you do laboratory work at KANA that somebody comes back and says that you're at risk for diabetes. And this is when your blood sugar is just a little bit higher than it should be on average. And there's ways of working with that and fixing it. Some of the common questions that we get for people who have diabetes or even at risk for diabetes is, what's going to happen to me? Am I going to get on medications? Am I going to be dependent on them forever? Well, it's different for every person, and it's going to matter what you do and how you treat it yourself. Hi, my name is Dr. Eben Jones. I'm a board-certified family physician who's been working at KANA for the past 10 years. When we talk about diabetes, what is it? Well, diabetes is when your body becomes a little bit resistant to insulin. The best way of treating diabetes is to prevent it altogether. And when we want to prevent diabetes, some of the best treatments we have for it are in your hands. We recommend 150 minutes of exercise a week. Seems like a lot, but if you just do a half an hour, 5 days a week, it's attainable. What kind of exercise should you be doing? It's a great question because there are lots of different exercises you may enjoy. That's the biggest number one thing I want you to do. I want you to do what you enjoy because you're more likely to do that day after day. I love hiking and I go for a hike every day pretty much. But some of the better exercises for diabetes is actually building up your muscles. So resistance training is good for a lot of things. I'm going to warn you, when you start exercising, you're actually going to feel worse for the first couple times you do it, and you're not going to want to do it. I want you to push through that because you will start feeling better after you start exercising. The other thing I want you to do is I want you to think about cutting out the refined carbohydrates. White flour, white rice, sugar, they're hard to quit. We're kind of addicted to all of those, and they taste great. And as you give them up, it's hard, but your body will get used to not having them all the time, and you'll find that it's easier to deal with not having them the longer you do it. Our big thing is trying to get your body tuned up so that it can deal with this disease. We can fix this together, and it is a fixable problem. There will be guides on the way. You're still in control. This is your body. You get to decide what's done with it, whether it's medications, exercise, or diet. But we're going to be advisors along the way, and we'd like to walk beside you so that we can come up with a good treatment for you.